Welcome. My name is Peter Strong and I'm a professional psychotherapist specializing in mindfulness therapy, which I offer online via Skype. Mindfulness therapy is a very effective way of working with anxiety, depression, or addictions. Basically, it is a way of changing those habitual thought patterns that sustain your anxiety or depression and diffusing the emotion underneath the reactive thinking that fuels that thinking. So we work at two levels, if you like, the cognitive level, as we might do in cognitive behavioral therapy or CBT, and also at the emotional level. So mindfulness therapy is a way of essentially learning how to become less reactive, more free, more responsive, and better able to deal with the triggers and the challenges of your life. So basically, the way we do this is that we identify those reactive thoughts and the emotion underneath the thought, and then we build a mindfulness-based relationship with these thoughts and emotions. We actually learn to meditate on the thoughts and emotions themselves. Rather than trying to push them away or avoid them, we actually invite them into our awareness and sit with them, as if you were sitting with a friend or a child. You establish a relationship based on consciousness, conscious awareness, and the quality of friendliness. So mindfulness therapy brings this quality of conscious awareness and compassion or friendliness to an art. And this is what creates the right conditions for emotions to change, and what allows us to break free from those patterns of negative reactive thinking that are fueled by those emotions. We have to learn how to sit with our emotions, make friends with them, and actually care for them. Most of us are not used to this idea of actually caring for our painful emotions or caring for our negative thoughts. Our impulse is to try and get rid of them. But that will not work, as you know. If you try to get rid of negative thoughts or negative beliefs or negative feelings, they simply get stronger, and if you try to avoid them, they simply chase after you. What actually does make the change possible is when you stop fighting them and running away from them, but actually meditate on them. You choose to be very present in an open way with this combination of conscious awareness and friendliness that we call mindfulness. When you do that, then you stop feeding those reactive thoughts, beliefs, or painful memories. When you stop feeding them through reactivity, then they begin to change. They begin to heal. They begin to transform themselves in that place of non-reactive awareness that we establish through the mindfulness-based relationship that we have with them. So this is a very effective method indeed, especially for working with anxiety and for overcoming depression. And it's a very good way of neutralizing those compulsive impulses that we experience in addiction and in other forms of obsessive compulsive disorder or OCD. So if you'd like to learn more about this approach, this mindfulness therapy approach to healing and transforming anxiety, depression, addictions, and other emotional problems, please visit my website, counselingtherapyonline.com, and email me, and then we can schedule an online therapy session via Skype. Most people see quite dramatic changes in very few sessions. Typically, after 2 to 3 sessions, you will notice very dramatic changes in the level of anxiety or depression and in the frequency of negative thinking. So, if you're interested in learning more about this approach, please contact me and let's schedule an online therapy session. Thank you.